May is Mental Health Awareness Month, and while the month of May is behind us, we can never focus enough on good mental health. This morning, we thought it would be a good idea to make a connection between mental health and resources. Like, where do we turn for help? Joining us this morning is Carla Lundeen with Great Rivers 211. Good morning, Carla.
Good morning, Crystal. Thanks for having me.
Yeah, thanks for joining us. So Great Rivers 211 is often described as somewhat being a resource to find resources. Can you share a little about what this can be utilized for?
I sure can. So you're right. It's a great description. We are a resource to find resources. We help connect people with community information and resources that can help them meet their needs, whether that's related to housing, maybe they need some financial assistance, maybe they're looking for a new job and they need to find some resources around that. We really collect those resources in our community, make sure they're current and up to date, and then we help connect people with those resources.
Some of those things you mentioned, housing, transportation, and even paying bills, are often referred to as social determinants of health. Are you seeing more and more calls on these issues, or who exactly is looking for resources?
That's a great question. So yes, social determinants of health, those conditions, those non-medical conditions that really have a huge impact on how healthy we are, whether that's where we work, where we live, where we go to school. All of those things come together and have a significant impact on our physical and mental health and wellness. So, for as long as 211 has been around, that's kind of been the space that we live in. We help connect people who are maybe struggling with paying for utility bills, paying for resources, paying for their health care, things like that. Just really help them get connected to those resources. And yes, we are seeing more and more calls from individuals. Last year, we had over 24,000 people reach out to us looking for information and resources. And anybody can call 211. We've had children as young as 12 years old reach out to us for assistance, and then older adults as well. So it's free, it's confidential, and we're also available 24 hours a day. So if you're like me and you might be up at 2 o'clock in the morning having a worry about something, you can reach out to us at 2 o'clock in the morning and say, hey, I just want to talk about what's going on with me. Can you help me find some resources? Can you help me get connected?
And Carla, how is getting connected to a resource through 211 making a difference towards good mental health?
Well, there's several ways. One of the biggest ways is kind of just what I was talking about. We have stresses in our lives, right? And whether that's maybe I'm looking for a better job. Maybe my job isn't bringing in enough money to help me make ends meet. We can help connect people with resources to help improve their status in life. We're seeing more and more people who are working really hard. Maybe both parents are working. Maybe they're working a couple jobs and still not able to make ends meet because food costs, childcare costs, transportation costs, everything seems to be increasing. And a lot of these folks that are working so hard, they're above that poverty line. They're not eligible for a lot of resources that others who might be below that poverty line are. So we're getting a lot more calls from people who haven't reached out to us before, who are those folks that are working really, working, like I said, several jobs maybe, or both parents are working and they're just really still struggling to make those ends meet. And we're just grateful we can be there to help support them.
Well, thank you for joining us this morning, Carla.
Thank you. Have a great day.
Thank you. You too.